Come in.
Can I come in?
Yes.
Well, hello.
Hi.
This is Trisha.
Hi, Trisha.
My name's Trisha. I'm going to be your nurse today. How
Nice
are
to
you
meet
feeling today?
I'm doing well. How are you?
That's good. So, first thing I would do is ask the patient, of course, how's he feeling today? He said he's doing great. Are you having, and then I would ask him any symptoms he's having. Do you have anything wrong with your chest? Are you having any cough? Are you producing any sputum? Anything like that?
What's sputum?
Sputum is excessive mucus that comes from your lungs.
No, I'm not. Thank you.
Okay. No cough?
Nope.
Do you smoke?
Nope.
Do you use chewless tobacco?
No.
That's good. So, the first thing I'm going to do is just take a general look at him to make sure he's, healthy. He's a well-nourished male. Now, sir, I'm going to have you remove your shirt. This is a fine specimen we have here. Now, I'm going to have you turn so I can see your back. You always make sure that the patient is comfortable. And look at inspect his chest, his back, like I am right now. First thing I do is you look, and I'm going to check to see if his chest expansion is correct, or is equal. So you put your hands here, and sir, I'm going to have, Darrell, I'm going to have you take a deep breath. And they both moved equally. One more time for me, please. Okay. So it was good. So the next thing I'm going to do is I'm going to percuss. And the first thing you're going to do 3 on the top. 1, 2, 3. So like that. And it should be dull, which it is. Then you're going to over the lungs. And see if there's any it's kind of sounded cool there. And the pattern you want to do is you want to one side and compare it to the other. So like 1, 1, 2, 2, 3, 3, 4, 4. And then since the lung fields kind of go this way, you're going to do a pattern of 4. So this side, then over here. And it sounds hollow because it's his lungs. So he sounds really good. So that was palpate and percuss. Next thing I'm going to do is take a listen to his lungs. Now, if the person has a difficult time with making sure they have a good breath sound, you can always take a tissue, especially for pediatrics, and you're going to have them blow so that it blows out and moves the tissue. You blow out, take a deep breath. There you go. Do one more time. Thank you. So now, we're going to continue that breath as I listen to your back. Again, we're going to do the same thing we did for the percuss. I'm going to take a deep breath. Blow it out. Take a deep breath. Blow it out. Deep breath. Blow it out. One more time. Deep breath. Blow it out. This side. Down here, do the 4. Take a deep breath. Blow it out. Deep breath. Blow it out. Deep breath. Blow it out. One more time. Sometimes it might feel as if your patient's hyperventilating, but they're fine. And last time. Okay. His lung sounds were clear throughout. So you notice I did the pattern of listen to one side, then the other side. Stay on that side, then listen. So I did that pattern. So his lungs look good. So we have the patient turn around. Sir, can you turn around? And we look at the front to make sure his chest is good. And then we're also going to make sure his chest expands properly. So, sir, can you take a deep breath for me? Excellent. Very good. Okay. So, the lung inspection and chest inspection is good. So now, the next thing we're going to do is we're going to have him lay down and we're going to inspect his abdomen. Sir, can you lay down for me? Okay. And again,
It's a bad angle.
the first thing you want to do is inspect and make sure that you don't see anything abnormal or any bulges or any red marks. And it's a nice chest and abdomen. So in the inspection part, it looks good. The palpate, you want to divide the abdomen up into 4 quadrants. So you draw a midline here through the umbilicus, and then the umbilicus is going to be like your halfway point. So this is the right upper quadrant. No, is it right or left?
Yes, it's right.
Right. Sorry. Yeah, right. Right upper, right lower, and left upper. So you have that. So that's what you're going to do. And you kind of, the major organs, which are in one. So you look at it, and the major organ in this side is your liver. And you kind of want to make sure when you palpate, and if you palpate over the liver, it's like a doll, because it's nice and blood-filled. Over here is the stomach. So you can, actually, you know what? I did this all wrong, because I was supposed to do auscultate first. So let's do that first. So with the abdomen, I clearly was wrong. You do the inspect, then the auscultate, palpate, and percuss. So you do it wrong. So, starting again, so we've inspected, now we're going to do the auscultate. The reason why is if you might get false positive, if you do the percuss and the palpate first by actually stimulating the bowels and causing the bowel cells to be hyperactive. So that's why you do it the other way. So we're auscultating. You place your stethoscope on the abdomen, and you listen. You have to listen for a full minute. And for normal sounding vowels, you want to hear 5 to 30 clicks per minute, or gurgles, or whatever. And they're moving around. And you do each section correctly. And the right lower. They're moving. Okay, so the auscultating is done. Now for the palpating. So you can actually kind of feel, if you want to have the patient relax. You can also, if the abdomen feels tight, you can have the patient bring his knees up onto the edge of the bed. So it actually helps reduce the muscle tension in the abdomen. And you kind of want to feel and watch the patient to see if he's having any problems or any wincing, if something is wrong. So, like I said, the liver's in this side, the stomach is in this side. This side is the descending colon. A little tight there. Do you need me to rub that for you? Not really. And then the appendix is in this side. One of the neat things they always tell you that for rebound tenderness, when you have appendicitis, is you put your fingers in, and there's no pain, but when you let go, it causes pain, rebound tenderness. And then we palpate. Of course, fluid-filled organs are dull, or blood-filled, so liver is dull. Hollow-sounding organs, I can't get them to sound.
He just ate.
Sorry.
So yeah, and that is what you do. You also ask the patient if he's had any gastric problems recently. Do you have any diarrhea or constipation, acid reflux, any bowel problems like hemorrhoids or blood in the stool or anything like that?
No, pretty regular guy.
Pretty regular guy. And that is it. This is also my husband. I love you. Mwah.
Are we done?
And that is all. This is TBaldosser, and I'll see you at the movies.